Hello, my name is Dr. Elias Tsakos. I'm a gynecologist and obstetrician, and also a specialist in fertility medicine and surgery, and also a fully trained surgeon in gynecological surgery, including minimal access surgery, hysteroscopy, laparoscopy, and robotic surgery. I have been fully trained and certified in England. And in the last 26 years, I have been practicing in Greece in a multidisciplinary team with Embryoclinic, where we offer IVF services and fertility services, but also the full range of specialized gynecological services, mainly including minimal access surgery and robotic surgery for benign infertility conditions. My team consists of 35 full-time members, 5 of whom are doctors. We have 4 embryologists. We have 8 midwives and a number of health assistants, administration staff, and also a quite significant number of associated specialists of all specialties involved in gynecological and obstetric care. Our base is in Thessaloniki, which is a beautiful city in the north of Greece, a beautiful port, a city of 2,500 years of history. Only down the road, Aristotle was born and some other eminent ancient people. And we're very proud to include in our community many nationalities, not only from the Balkans, but from further away. And Thessaloniki is considered to be a crossroad of civilizations. Our motto here is that Thessaloniki has many stories but one heart. So if you ever visit, I believe you will sense this the minute you land your foot on the ground. Our clinic is based centrally. We're also associated with a large private hospital, St. Luke's Hospital, which is just up the hill. 10-minute drive from the city, where we perform all our inpatient procedures. And everything started in the late 90s. Upon my return in England, I started slowly building a team. The team initially was 3 to 4 people. Now we're 35 full-time, plus another 5 or 10 associate specialists and part-time external colleagues and associates. We are very happy and proud that for 26 years we've been caring for patients from all over the world with the most complex fertility, but also general gynecological conditions. We have been involved in research and publications, academic work over the years. We have published books, chapters, papers, and we have been honored to be invited regularly, a couple of times a month, in national and international conferences. So our mission is very simple. We want to deliver world-class individualized fertility care for patients, and many times this includes also gynecological care in a safe and ethically grounded environment. We want to combine, and we have been striving to achieve that, advanced technology together with evidence-based medicine, and also compassionate support, so that every patient's journey to parenthood is respected, understood, safe, and successful. Also, we have resisted to takeovers from business people and from funds. So we retain our medical status. We're amongst the very few IVF clinics in Europe, as far as I'm aware, that are owned and run by doctors. So we, with all due respect to the other clinics, we, on our daily practice, medicine is at the forefront of our priorities. I keep saying that we're not very good business people, because if we were, I wouldn't be working until 10 in the evening every day, and I wouldn't be enjoying it. However, we try to deliver the best possible care for the individual patient. For us at Embryoclinic, treating patients is not a mechanical process of diagnosis and treatment. It's a privilege to be part of someone's most vulnerable and important moments, moments which are always filled with hope, but also trust and sometimes anxiety. So patient-centered care for us, it means seeing the person, the human being, before the patient. The inspiration to pursue a patient-centered care certificate was the utmost desire to place people before the procedures at the heart of our work. Infertility, in medicine and infertility in particular, our patients often arrive with a lot of years of hope, fear, and emotional pain. So I wanted my clinic, Embryoclinic, to formally embrace a standard of care that recognizes not only the science of conception, but also the humanity of those who seek it. This certification perfectly aligns with our mission, which is to combine world-class medical expertise with genuine empathy, honesty, and partnership. The certification journey was enlightening. It encouraged us to view the clinic from a completely new perspective. This is through the lens of those who we serve. We discovered that even small adjustments in communication, patient flow, or feedback process can create profound improvements in how people feel during their medical journey, which is very important for them and for the journey itself. It also reaffirmed that our greatest strength at Embryoclinic lies in our human connection, our ability to listen, to reassure, and to care beyond what is expected. I have the privilege of working as a soldier and as a general, as a CEO. And this is an amazing privilege because it helps me understand all aspects of the fertility care and of the medical care. So my role is to nurture a culture where every member of the team has ownership of our shared values. I'm very proud of each one of them. They're all very diverse. They come from amazing backgrounds. They're highly educated. In our clinic, we have about 6 or 7 PhDs. We have probably a dozen of master degrees, lots of diplomas, and dozens of bachelor degrees. But apart from that, we have dedicated people who would go the extra mile to serve for the patients. So patient-centered care cannot exist without teamwork. It requires that every professional, from reception to surgery, carries with them the same compassion, the same attention to detail, and the same respect for human dignity. And that is the dignity of our patients and the dignity of our souls as well, because we want to know that we've done our very best for each and every patient. We achieve this teamwork, this alignment through daily communication. We hold daily meetings in the afternoon at 3:30 every day. The entire team is gathered together at the clinic. If some of us are away in the hospital or at conferences, we still connect, we still engage in that meeting. And it's very important to communicate every single patient, every single issue, every single research project, etc. We have feedback loops. We have lots of examples, lots of stories, and of course, we celebrate small victories every day and the victories of our patients. I make it a priority to keep patient stories at the heart of every discussion, because stories remind us of why we do what we do. Well, 26 years into this journey, and this certification is by no means the end. It's the beginning. We plan to continue investing in staff development, feedback systems, and innovation that improves both patient outcomes and also emotional experience. We aim to create an environment where patients feel heard, informed, and involved in every decision. I would definitely recommend this certification to any clinic, IVF, gynecology, general medicine, not just for recognition, but because it helps transform culture, improve culture even more. It unites teams and reinforces the purpose behind healthcare to serve with science, skill, but also with heart. My advice to other clinics applying for this certification is to embrace the process as an opportunity for growth rather than as a formality. Certification is not just about meeting standards, it's about reflecting deeply onto patient experience, safety, and the values that guide our daily practices. I would urge you to involve your team, your entire team from the start, to ensure transparency and open communication and focus on genuine patient-centered care rather than just documentation. And most importantly, let the process highlight your strengths while keeping your identity and improve areas that can elevate your service to the next level. And believe you me, there's always room for improvement and there's always space for elevation.